Thanks for joining us. I'm Pam Giganti. This week begins the open enrollment period for those seeking health insurance through the Affordable Care Act or Obamacare. Florida led the nation in Obamacare enrollments for 2017 with 1.4 million people signing up. But the uncertain future of the Affordable Care Act has many concerned. Now, a new documentary is giving us an inside look at how the U.S. healthcare system compares to the rest of the world. Let's take a look at GAUZE, Unraveling Global Healthcare.
Thank you for calling eHealth Insurance for your life insurance needs. Please note, your call may be monitored for quality assurance. All agents are currently unavailable.
I'm on the phone with the hospital and I'm going nuts right now.
Hi, this is Suzanne Garber. I recently submitted an application through eHealth for the healthcare marketplace. And I'm looking for a call back, please. Again, this is Suzanne Garber, 305.
Call ended.
I got 2 more invoices today, $1,600 for the anesthesiologist and $1,200 for the pathologist.
Problem with this?
To inform you about this, but as I checked for Thomas Jefferson's status, they are appearing to be out of network.
And I said, well, how can you expect me to sign a form agreeing to pay for something that you can't tell me how much it's going to be? It's absurd to me. And she said, if you don't sign the form, you don't get the service. So let me get this straight. I need to sign away to pay for something. I have no idea how much it's going to cost.
Well, joining me now is Director and Executive Producer of GAUZE, Suzanne Garber, and Director of the Center for Health Sector Management and Policy at the University of Miami, Dr. Stephen Ullman. Thanks to both of you for being here.
Thank you.
Suzanne, we got to see a little clip there, and I got to see the whole thing. Very provocative, very thought-provoking piece on the state of healthcare in the United States. What drove you to say, I need to make this documentary?
Well, prior to embarking on this journey, I worked in an international healthcare setting and I became sick overseas. And I just realized as I was recovering in the hospital, because I found out 40 plus years later that I had a congenital heart defect. And I was very blessed and privileged to know where to go, and maybe more importantly, where not to go in terms of finding quality-driven, accessible, and affordable healthcare. And I just thought, from my own experience, I can't go through something as magnanimous as this and not share with other people the options and resources that are available throughout the whole world in terms of finding the best in healthcare. And that's really what consumed me, was that definition of best and sharing that with others.
Because it wasn't necessarily about cost, because as somebody watches it, they might walk away with, it's really about the cost of healthcare. And you were telling me earlier, it was really more about best healthcare and how we define that, right?
Absolutely. I think very often it's difficult for us to define best in healthcare, maybe because we don't know what that actually looks like, or we've been so accustomed to having somebody else define best for us. We don't usually hear people talk about their healthcare in terms of the best mammogram that they've ever had, or the best colonoscopy. We can talk about, the best cup of coffee, or the best vacation, and the best night's sleep, and the best piece of pizza, because we can determine that for ourselves. But best in healthcare, we allow others to define that for us.
Dr. Ullman, you also got the opportunity to watch it. What was your take?
I guess, and again, the quality, and it also does talk about the cost as well, because you talk about value. Value is the big thing right now. The concept, if you are having a high-cost healthcare system, at least if you get high quality from it, then that's value. If you're buying something that's really expensive, and we have the most expensive healthcare system in the world by far. And by the way, South Florida has the most expensive community of healthcare costs in the U.S., therefore in the world. And you get lousy quality for that. It'd be like buying a cup of that very expensive coffee that I tend to drink. And if I drink it and I say, this is great coffee, that's value. If I take that same cup of coffee and spit it out and say, this is horrific coffee, that's low value. And we talk about value in terms of this, being the most expensive and then having life expectancy rated at 42nd in the world in the United States, and infant mortality ranked at 57th in the world. Something's not right, and Suzanne brings that up.
I think that's shocking to a lot of people, those numbers. You bring that up in the piece. What I want to do now is show another clip from the piece where you're actually talking to a gentleman in the UK. Let's take a look.
We've seen obviously the public sector, the NHS, try to encourage people to take and adopt a more healthy lifestyle. There's been discussions about, should you penalise people? You know, if they're obese, then should they kind of pay a price for that in terms of access to healthcare? Same if they smoke, should they pay a price for that in terms of access to healthcare? In recent years, the kind of advent of insurance schemes in the UK that reward you. You know, you get points, you get discount off your health insurance if you go to the gym a certain number of times, and they record and log that. So, you know, they realise that in the long term, preventive or positive, you know, approach to healthcare saves money, but it takes a long time to change people's ways.
All right, Dr. Ullman, let's talk a little bit about that, because you're the expert on health insurance in the United States. A lot of insurance companies encourage people to have those sort of wellness screenings. They ask you those questions. Do you smoke? Do you exercise? So we sort of have something very similar to that in this country, do we not?
We ask the questions. Whether we actually punish or provide reward for that is a different story. Basically, the only thing that's consistent is the tobacco use. And so in terms of weight, or in terms of our eating habits, or in terms of our lifestyles and other aspects, we tend not to get into that, and insurance tends not to reflect that in terms of its pricing at this point in time, not in the U.S.
So Suzanne, talk a little bit about more of what you learned, because you went not only to the UK, you went to Singapore, you went to Thailand. I mean, you really traveled the globe. So talk about those experiences and what you learned.
Yeah, well, we wanted to go to places that were somewhat off the beaten track. So we went to places like Belize, we went to Sri Lanka, we went to Japan, we went literally to 24 countries over a period of about 18 months, logging over 100,000 miles and getting into some very unique situations in terms of hospitals. Sometimes we had proper appointments, they were preset, we were allowed to come in with our camera crews. Sometimes we weren't given access, and sometimes we just went in on our own to see what could we see. And it was really fascinating to see the levels of care intra-country as well as intra-city in some cases. And you know what? It's actually not that dissimilar to here in the United States, because you can have centers of medical excellence in one geographic area situated next to places that are maybe a little bit more needing of improvement in other areas too. So we saw that across the board. What I would say was very different across the board in most other countries was the accessibility to healthcare for all of its citizens and residents, whereas we don't necessarily see that here in the United States. Not everybody has the same equal access to healthcare that we see in other countries. And that was very, very starkly pointed out in places like Hong Kong or Singapore or even India.
But wouldn't somebody say, okay, well, if you go to a country where there's subsidized medicine, everybody's going to get care, they're probably going to get about the same care. And then others would argue, well, that's what's so great about the United States. I can pay for this great care with an excellent doctor who studied at Yale School.
But we were comparing notes. We were both in Brazil, for example, doing work down there. So I visited the Albert Einstein facility down there. So a brain scan in Miami-Dade County, a specific type of brain scan, will range in this county between $900 and $3,100. At the Albert Einstein facility, when I was visiting there and visiting with the CEO, we went to visit the radiologist. Radiologists are trained at the University of Chicago using Siemens equipment, trained in Germany on the Siemens equipment. Their cost, their price, $90. $3,100 in Miami, $90. And this is why 900,000 plus Americans go overseas for their health care every year.
Okay, so why? Why is this happening to us that in the United States the cost is so high?
It's a very complex issue. If we could point to just one aspect of healthcare, it'd be so much easier to fix, but it's not. We've created an entire ecosystem of organizations that are interdependent upon each other. So whether we talk about even starting from the food industry, because again, it does come back to a lot to preventative health, the food industry, the pharmaceutical industry, the medical device makers, the actual caregivers, the insurance companies themselves. It's interesting because we talk about healthcare as a consumer business, but it's really not relegated to a consumer. It's really more relegated to an employer model. And so if you are employed, you have the benefit of having that insurance for you to take care of that high cost. But if you're an individual consumer or purchaser of healthcare, it doesn't work in your favor. So if I could point to one aspect of healthcare that said, oh, it's the pharmaceuticals, and sometimes appropriately so and sometimes inappropriately so, pharmaceuticals are pointed out as having, 1,000% times the markup on what a drug should be. But it's not just that. There's so many other aspects that go into it. In addition to our litigious society, which certainly increases fees for doctors.
Right. quickly, because we're running out of time. So the last comment, Doctor, what do you tell people when they're sick? Especially now the ACA enrollment's opening up, people are looking to get insurance. What do you tell them?
God help them.
Oh my.
There are over 50 choices in the Miami-Dade alone for healthcare system or healthcare plans to choose from. So it's really mind-boggling and very difficult for the average person to figure it out.
Kind of do your homework and.
Definitely.
All right, thank you both so much. The piece is great. GAUZE, we want everybody to check it out. You can watch GAUZE, Unraveling Global Healthcare, right here on South Florida PBS, Monday, November the 6th at 10 p.m. on WPBT Channel 2, and on Friday, November 10th at 9 p.m. on WXEL. And do you have a story on healthcare or other topics that you would like to share or discuss? We want to hear from you. Send us your take. You can reach us on Twitter and Facebook at YourSouthFL. Send us a message or a video. We look forward to hearing from you. People signing up. But the uncertain future of the Affordable Care Act has many concerned. Now, a new documentary is giving us an inside look at how the U.S. healthcare system compares to the rest of the world. Let's take a look at GAUZE.
I'm on the phone with the hospital and I'm going nuts right now.
Hi, this is Suzanne Garber. I recently submitted an application through eHealth for the healthcare marketplace. I'm looking for a call back, please. Again, this is Suzanne Garber, 305.
Unraveling Global Healthcare.
Thank you for calling eHealth Insurance for your life insurance needs. Please note, your call may be monitored for quality assurance. All agents are currently unavailable. Ended.
I got 2 more invoices today. $1,600 for the anesthesiologist and $1,200 for the pathologist.
Problem with this.
To inform you about this, that as I checked for Thomas Jefferson's status, they are appearing to be out of network.
Thanks for joining us. I'm Pam Giganti. This week begins the open enrollment period for those seeking health insurance through the Affordable Care Act or Obamacare. Florida led the nation in Obamacare enrollments for 2017 with 1.4 million people